Welcome, everyone. We're diving into a topic today that's, well, incredibly important and often quite challenging for future healthcare professionals. It requires real clinical skill, but also a deep sense of empathy.
That's exactly right. We're talking about suicide and non-suicidal self-injury, or NSSI.
Yeah, and this isn't just theory. We're focusing on practical life-saving skills, drawing directly from a key chapter in Varkarolis's Foundations of Psychiatric Mental Health Nursing. That's the 8th edition by Margaret Jordan Halter.
And we've really tailored this deep dive for you, the nursing student. Think of it as a shortcut to help you get a solid grasp on these complex ideas, getting you ready for the NCLEX and, for actual practice.
Absolutely. Our mission here is to pull out the most vital nuggets from this material. We'll explain the key psych nursing concepts accurately, professionally, but keep the language straightforward and accessible.
We'll cover the whole spectrum, from definitions and risk factors, all the way through assessment and interventions. And crucially, how it all connects back to your responsibilities as a nurse.
So just to give you a quick roadmap, we'll start by defining some essential terms, things like suicidal ideation, suicide attempt, completed suicide. Got to get those clear first.
Definitely. Then we'll look at the scope of the problem suicide as a public health issue, particularly here in the U.S. It's a growing concern.
And from there, we'll get into comorbidities, the other psychiatric conditions that often go hand in hand with suicidality, plus a really thorough look at the risk factors.
Comprehensive range, yeah. And you'll learn about the evidence-based tools nurses actually use for suicide risk assessment. Real practical stuff.
Then we'll shift into interventions, basic level things you can apply in hospitals, in the community. We'll talk suicide precautions, environmental safety, super important.
And we'll also touch on something maybe less discussed, the nurse's own reactions when caring for suicidal patients. It's important to acknowledge that.
Good point. And finally, we'll explore nursing interventions specifically for non-suicidal self-injury, NSSI. So yeah, it's a packed agenda, but honestly, every piece is fundamental for your toolkit. Ready to unpack it.
Let's do it. Okay, first up, understanding suicide and suicidality. The numbers, the epidemiology in the U.S., they paint a pretty somber picture. It's a significant public health problem, and unfortunately, it seems to be growing.
And it's important to remember these aren't just statistics, right? Each number represents a person, a family, a community impacted.
Exactly. Recognizing the sheer prevalence and impact is really step one for effective intervention, yes, to grasp the scale of it.
And something the source really hammers home is comorbidity. Suicidality rarely just exists on its own, does it?
Very rarely. It's vital for you as nurses to know that.
Yeah.
They very often co-occurs with other conditions. We see it a lot with mood disorders, major depression, bipolar disorder, for instance. Also, substance use disorders are frequently linked. Anxiety disorders, too, and notably certain personality disorders, like borderline personality disorder.
So understanding those connections is key.
Absolutely critical, because often effectively treating that underlying condition is a core part of the strategy for preventing suicide. You have to see the whole picture.
Okay, that's clear. So beyond those co-occurring disorders, let's talk risk factors. The textbook breaks them down into different categories, which is helpful. What about biological factors?
Right. From a biological angle, research points towards genetic predispositions. So a family history might increase someone's vulnerability.
Okay.
And neurobiology plays a part too, particularly issues with serotonin function. Studies have found lower levels of serotonin metabolites in cerebrospinal fluid in people who've attempted suicide. It suggests there's a biological component there.
Interesting. So biology is definitely a piece of the puzzle. What about the psychological side? What makes someone vulnerable psychologically?
Well, psychologically, a huge factor is pervasive hopelessness. That feeling that things won't get better. It's a really strong predictor.
Helplessness.
Also, impulsivity, acting without thinking things through, poor problem solving or coping skills. A history of trauma or abuse is significant. And certain personality traits, too, like extreme perfectionism or really harsh self-criticism.
And then there's the environment, right? A person's surroundings must play a role.
Oh, profoundly. Environmental factors are huge.
Yeah.
Things like easy access to lethal means firearms, certain medications, things like that. That's a clear and, importantly, often modifiable risk.
Ah, modifiable. Good point.
Yeah. Also, social isolation, feeling cut off, alone, adverse life events, losing a job, a relationship ending, major financial stress. And as we mentioned with genetics, a family history of suicide can also increase environmental risk through exposure and grief.
And layered on top of that is culture, which shapes so much of how we see the world and ourselves. How does that factor in?
Culture is incredibly important. It affects how mental health is even perceived, let alone talked about or treated. Cultural beliefs, stigma around mental illness, these can unfortunately stop people from seeking help.
Yeah, the stigma can be powerful.
Definitely. And the stress of acculturation, for immigrant populations adjusting to a new environment, that can also be a factor.
Yeah.
But it's not all negative, strong cultural protective factors like close family ties, community support, spiritual beliefs. Those can be incredibly powerful in reducing risk.
So it cuts both ways.
It really does.
And then zooming out even further, societal factors like big events or trends.
Yes, absolutely. Things like major economic downturns can increase stress across populations, widespread trauma from, say, natural disasters, even how the media reports on suicide matters. Irresponsible reporting can sometimes contribute to contagion effects. So public messaging needs to be really thoughtful.
That makes sense. So biological, psychological, environmental, cultural, societal. Any other major risk factors nurses absolutely need to keep on their radar?
Yes, definitely. One of the absolute strongest predictors is a previous suicide attempt. Anyone with a history of attempting suicide is at significantly higher risk for completing suicide later.
Wow, okay. That's critical to know.
Critically important. Also, chronic physical illness and the pain or loss of function that comes with it. Being incarcerated is a major risk factor, and recent significant losses, death of a loved one, divorce, that kind of thing, nurses need to be assessing for all of these.
Okay. So understanding all those risk factors is the foundation for assessment. How might suicidality actually present? What are the signs, overt and maybe more subtle, that a nurse should be watching for?
Right. The clinical picture, it can show up in direct ways, overt verbal clues. Someone might say, point blank, I want to die, or I'm going to kill myself. Very direct.
Hard to miss those, hopefully.
Hopefully. But you also have to be attuned to the subtle indirect signs. These can be verbal, like someone saying, I won't be a problem for you much longer, or it'll all be over soon, or even, you'd be better off without me.
More veiled.
Exactly. And nonverbal clues are just as critical. Changes in behavior, maybe increased anxiety, agitation, pacing, or withdrawing socially, becoming isolated, giving away possessions that are important to them, making a will, putting affairs in order, and sometimes, maybe counterintuitively, a sudden, unexplained improvement in mood after being severely depressed can be a warning sign.
Really? Why is that?
Well, sometimes it can indicate that the person has made the decision to die and feels a sense of relief or peace with that decision. I actually remember a case, a patient who'd been deeply depressed, barely engaging, suddenly seemed cheerful, almost euphoric one morning.
That seems like a good thing on the surface.
It does, but to the experienced nurse, it rang alarm bells. It prompted a more urgent assessment, and unfortunately, it turned out the patient had finalized a plan. So that sudden shift, while seemingly positive, requires very careful evaluation.
Wow. That's a really powerful example of why vigilance is crucial even when things look better. Okay, let's really get into the nursing process for suicide prevention. This is core stuff for nursing students. Starting with assessment, what specific clues, verbal and nonverbal, are we looking for?
So assessment is ongoing, but initially, you're listening carefully for those verbal clues we mentioned, both direct, I want to die, and indirect, I can't see any way out, and observing nonverbal behavior. Are they agitated, withdrawn, tearful? Are they giving away belongings? Any sudden changes?
And here's something the NCLEX really emphasizes, assessing the lethality of a suicide plan. How do you do that? How do you figure out the immediate risk?
This is where you have to ask direct questions, even if it feels uncomfortable. It's essential for safety. You need to evaluate 3 key things about any plan they might have. 1, the method. Is it highly lethal, like using a firearm, jumping, or hanging? Or less lethal, like superficial cutting or maybe taking a small number of pills?
Okay, method, lethality, what else?
2, accessibility of the means. Do they actually have the gun, the pills, access to the bridge right now? Or is it just a vague idea?
Method, access, and the third.
3, the likelihood of rescue. Is the plan detailed? Have they thought about timing, location? Is it planned for a time when they're likely to be alone and undiscovered? Or is there some chance someone might intervene?
So method, accessibility, and chance of rescue.
Exactly. A highly lethal method with immediate access to the means and a low chance of rescue. Well, that indicates a very high acute risk that requires immediate protective intervention. You have to act fast.
That really clarifies the urgency and the specific things to assess. Now, what about the nurse? The textbook mentions self-assessment. Why is that important?
Oh, it's absolutely vital. Caring for suicidal patients can evoke strong feelings in the nurse. Fear, anxiety, maybe frustration, helplessness, even anger sometimes, or profound sadness.
Yeah, I can imagine.
Recognizing your own reactions is crucial. It helps you maintain objectivity, prevents burnout, and most importantly, ensure your feelings don't unintentionally cloud your judgment or affect the therapeutic relationship. You need self-awareness and, honestly, support for yourself through supervision or debriefing. It's not optional, it's part of professional practice.
That's such an important reminder. Okay, assessment done. Next step. Diagnosis. What's the primary nursing diagnosis here?
Based on that thorough assessment, if the risk is present, the key nursing diagnosis is typically risk for suicide. Simple, direct, and it drives the care plan.
And what are the goals, the outcomes criteria? What are we aiming for?
Immediately, the priority outcome is patient safety. For example, patient will remain free from self-harm. Long-term, you're looking for outcomes like patient will identify alternative coping strategies, patient will develop a safety plan, or patient will express feelings of hope for the future. Measurable goals.
Right. So then we plan. What does that involve?
Planning means creating that comprehensive, individualized care plan. It's based directly on your assessment findings and the diagnosis. It needs to be patient-centered, involving the patient as much as possible, and clearly outlining the specific interventions needed to keep them safe and help them move forward. It's the blueprint for care.
Okay, now the interventions, the doing part. Let's start with psychosocial interventions. What are the key nursing actions there?
Psychosocial interventions are foundational. Therapeutic communication is key active listening, showing empathy, validating their pain without validating the idea of suicide. Building a strong, trusting therapeutic relationship is paramount.
That trust seems crucial.
It is. Then there are crisis intervention strategies for the immediate situation, and longer term, helping the patient build healthier coping skills, problem-solving abilities, ways to manage overwhelming emotions without resorting to self-harm.
Makes sense. What about psychobiological interventions, medications, for instance?
Yeah, pharmacology often plays a role. Medications are used to treat the underlying conditions driving the suicidality, antidepressants for depression, mood stabilizers for bipolar, maybe anxiolytics for severe anxiety. The goal is to reduce those symptoms that are contributing to the suicidal thoughts.
And the source also mentions somatic interventions like ECT.
Yes, electroconvulsive therapy, or ECT. For some patients with severe treatment-resistant depression, especially with intense, acute suicidal ideation where other treatments haven't worked fast enough, ECT can be a very effective, even life-saving intervention. It can provide rapid relief when it's desperately needed.
Okay. And health teaching, how does that fit in?
Health teaching is huge. Educating the patient and their family about warning signs, about the importance of sticking to the treatment plan, how to use their safety plan.
Safety plan, can you say more about that?
Oh, definitely. A safety plan is a concrete, written plan the patient develops with a nurse or therapist. It lists coping strategies they can use when they start feeling distressed, people they can call for support, friends, family, crisis lines, and steps they'll take to keep their environment safe. It's a practical tool they can refer to in a crisis.
That sounds incredibly useful.
It really is. Health promotion also involves teaching stress management, healthy coping mechanisms, building resilience, empowering them with skills and knowledge.
And case management, why is that important?
Case management ensures continuity of care. It's about coordinating with the whole team, doctors, therapists, social workers. It involves facilitating referrals for outpatient therapy, support groups, making sure there's a smooth transition when they leave the hospital.
Yeah.
That seamless handover is vital for preventing relapse.
Okay, let's talk milieu therapy. This is especially key in inpatient settings, right? Suicide precautions, environmental safety. This feels like really core nursing responsibility.
Absolutely critical. This is where the nurse's role in maintaining safety is most visible. Milieu therapy is about creating a safe, structured therapeutic environment.
So what does that involve specifically? Suicide precautions.
Key elements include things like level of observation, maybe one-to-one observation, where a staff member is assigned to be with the patient constantly within arm's reach, or maybe checks every 15 minutes. It depends on the assessed risk level.
Constant vigilance.
Yes. Also, contraband checks removing anything the patient could use to harm themselves. Sharp objects, belts, cords, plastic bags, sometimes even things you wouldn't immediately think of. And ensuring environmental safety, removing ligature points like shower heads, doorknobs, curtain rods could be used for hanging, making sure windows are shatterproof or secured. It's about anticipating and removing any potential hazard.
That sounds incredibly detailed and requires constant awareness from the whole team.
It does. It's a huge responsibility, but it's not negotiable for patient safety in an inpatient setting.
Documentation is always emphasized in nursing. What's key when documenting care for a suicidal patient?
Precision, clarity, timeliness. You need to document your assessments, the risk factors, the patient statements, your lethality assessment. Document all the interventions, the precautions implemented, the communication, medication administration, and crucially, the patient's response to those interventions. This is vital for continuity of care, communication between shifts, and also for legal reasons. It shows you followed protocol and provided appropriate care.
Right. What about postvention? That term might be new to some students.
Postvention is the support provided after a suicide has occurred for the family, friends, peers, even caregivers left behind. It's about helping them process the grief, reducing trauma, answering questions, and importantly, preventing potential suicide contagion among others affected by the loss. It's a crucial part of a community's response.
That's really important work. And for nurses who specialize, advanced practice nurses, what's their role?
Advanced practice psychiatric nurses have a broader scope. They can provide psychotherapy like cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, which are very effective. They often have prescriptive authority for medications, and they manage complex cases, designing and leading comprehensive treatment plans.
Okay. And finally, for suicide, the evaluation piece of the nursing process.
Evaluation is constant. You're always assessing, are the interventions working? Is the patient safer? Are they meeting the outcome goals we set? Are they using coping skills? Do we need to adjust the plan? It's a dynamic cycle, always reassessing and refining the approach based on the patient's needs and progress.
Perfect. Okay, let's shift gears slightly now to non-suicidal self-injury, NSSI. How is this different from suicide and how common is it?
Great question. NSSI is distinct because the intent is not to die. It involves deliberately harming oneself, cutting, burning, scratching, but without suicidal intent. It's often a way to cope with intense emotional pain or feelings of numbness or dissociation.
So the motivation is different?
The motivation is key, and it's surprisingly prevalent, especially among adolescents and young adults. Recognizing it, understanding its patterns, is crucial for nurses.
And like suicide risk, does NSSI often appear alongside other mental health issues?
Yes, absolutely. High comorbidity. It's strongly linked with borderline personality disorder, where emotional dysregulation is a central feature, but also very common with eating disorders, depression, anxiety disorders. Again, you need that holistic view.
Makes sense. What about risk factors specific to NSSI, similar categories?
Similar categories, yeah. Biologically, maybe some genetic factors, neurobiology related to emotion regulation, perhaps even differences in pain perception. Environmentally, a history of trauma or abuse is a big one. Peer influence can play a role. Sometimes, unfortunately, there's a social contagion aspect. Family dysfunction is often present.
And societal factors.
Media portrayal can sometimes normalize or even unintentionally glamorize self-harm. And easy online access to information or communities centered around NSSI can be a risk factor too.
So how does NSSI actually look, the clinical picture? What are the motivations nurses should understand?
Clinically, it can range from superficial scratches to more severe injuries. Location varies. Frequency varies. The key is understanding the function it serves for the individual. Why are they doing it?
Right. The motivation again.
Often, it's about emotional regulation, trying to relieve overwhelming feelings like anxiety, anger, sadness, or emptiness. Sometimes it's self-punishment. Sometimes it's a way to feel something when feeling numb or unreal, or paradoxically, to ground themselves or feel real when dissociated. It's a maladaptive coping strategy, a desperate attempt to manage unbearable pain.
Understanding that function seems critical for intervening effectively, so applying the nursing process to NSSI.
Assessment needs to be comprehensive and non-judgmental. You need to understand the triggers, what situations or feelings lead to the urge, the frequency, the methods used. Ask about the function. What does doing this do for you? Gently explore their understanding of it. And critically, always assess for suicidal ideation concurrently. Even though NSI itself isn't a suicide attempt, the underlying distress can increase suicide risk.
Again, the nurse's self-assessment.
Still vital. Nurses might feel confused, upset, or even frustrated by NSSI. Acknowledging those feelings helps you remain therapeutic and non-judgmental, which is essential for building trust with these patients.
Okay, diagnosis for NSSI.
A common one is risk for self-mutilation, or sometimes ineffective coping-related diagnoses.
And outcomes. What are realistic goals?
Goals focus on safety and building skills, reducing the frequency and severity of self-harm, identifying triggers before acting. developing and consistently using alternative, healthier coping strategies. It's about replacing the NSSI with something more adaptive.
How do we plan interventions for NSSI?
The plan needs to be collaborative, patient-centered, focus on safety, emotional regulation skills, and practical coping mechanisms. Building that therapeutic alliance is key to getting buy-in for trying new strategies.
And the interventions themselves, what can nurses actually do?
Therapeutic communication, again, is central to education, validating the pain while not condoning the behavior. A major intervention is teaching skills, often drawn from dialectical behavior therapy or DBT.
DBT skills, like what?
DBT offers really practical tools, things like mindfulness, learning to observe thoughts and feelings without judgment, distress tolerance skills, ways to survive crisis moments without making things worse through NSSI, emotion regulation skills, understanding emotions and learning how to manage their intensity, and interpersonal effectiveness skills, navigating relationships healthily.
So it's very skill-based.
Very much so. It's about giving them a concrete toolkit. We also help them identify and practice specific alternative coping strategies, maybe snapping a rubber band, holding ice, intense exercise, journaling, calling a support person, using distraction techniques, finding what works for them. Sometimes a safety contract can be used, where they agree to reach out for help instead of self-injuring.
Lots of practical options there. And evaluation for NSSI.
Same principle as with suicide risk, it's ongoing. Are they using the skills? Is the NSSI decreasing? Are they identifying triggers more effectively?
Yeah.
You constantly evaluate progress and adjust the plan based on their NSSIs and how they're responding to the interventions.
Wow. We have covered a lot of ground today. A really comprehensive deep dive into, well, two incredibly important and challenging areas in psychiatric nursing.
We really have. From the epidemiology and the many risk factors for both suicide and NSSI, right through applying the entire nursing process, assessment, diagnosis, planning, all those interventions, and evaluation.
And it's so important for you, our listeners, to remember everything we talked about. Therapeutic communication, milieu safety, lethality assessment, health promotion, DBT skills. It's not just stuff to memorize for an exam.
Not at all. This directly translates into what you'll be doing as a nurse. It's absolutely vital for your NCLEX success, yes, but more importantly, for providing safe, effective, compassionate care in the real world. Your ability to apply this knowledge, it literally saves lives.
It really does. And we know this field, psych nursing, it demands a lot. It takes courage, resilience, real strength. So maybe a final thought to leave you with as you continue on your journey. What does it truly mean for you as a future mental health professional to find ways to cultivate hope for your patients, to hold on to that hope, especially when they feel completely lost in despair and can't find it themselves?
That's a powerful question. It gets right to the core of it, doesn't it?
It really does.
Remember, you're not just accumulating facts and figures. You're actively cultivating the empathy, the critical thinking, the skills that will make you an exceptional nurse, an impactful mental health professional. Keep building both that knowledge base and your capacity for empathy.
Couldn't agree more. Thank you so much for joining us on this deep dive today. From the Deep Dive team, we really appreciate you tuning in and engaging with this vital material.